Chiropractic care versus back surgery. So this is a great one, and this one hits pretty close to home for me. Most people don't know this, but I did have a back surgery. I had a back surgery as a result of an injury that I had where I ruptured my spinal cord. Essentially, I had a disc herniation that caused what's called a myelopathy, and it caused issues down my leg where I didn't have pain, but I wasn't able to lift my leg. So there is a limitation where your body can't heal. That limitation is what we specialize in because I know it. I've seen it. I've lived it. The main thing that people need to know is when you're stuck in that point of, I don't have quality of life, you need to get some kind of treatment. Before is the best time. But if you're stuck in that position, you need to go to a doctor that can accurately diagnose you and prognose you. Now, what are the signs of, hey, I really need to consider surgery? Is typically loss of bowel or bladder function, meaning you're peeing yourself, you can't go to the bathroom, and or muscle weakness. The other one is muscle atrophy. So what typically happens is if you have some type of condition, typically it's going to be where the disc herniates and compresses the spinal cord. Depending on the amount of compression that's on the cord, it will cause dysfunction in the nerves, which will limit your ability to lift your leg, which will cause what's called drop foot on some people, where their foot is just slapping on the floor like this. You have to be sure that you go to a physician that's able to properly recognize this and treat your condition specifically. Now, not everybody needs back surgery, and to me, the key is this. Because I'm a living example, there's a time and a place for everything. There's a time where you say, hey, you need to really go to surgery. But most people will do better going through a course of specific treatment for their condition, which is what we focus on in our